Hi, I'm Dr. Danielle Brandman from the University of California, San Francisco. I'm here today speaking with Dr. Atsushi Tanaka from the University of Tokyo about his recent paper about primary biliary cholangitis in the East versus the West. Dr. Tanaka, thank you so much for speaking with me today.
It's my great pleasure.
So I was hoping you could tell me a little bit about what you've learned about the disease of PBC in the Eastern population versus the Western population.
Okay. So first of all, there are very few data regarding the epidemiology of primary biliary cholangitis (PBC) in the East, including Japan or Korea or China, East Asia. So compared to the East Asia, there are plenty of data regarding the epidemiology of PBC in the United States and the European countries. So people believe that there are very few patients with PBC in the East until 2010. But after that, including my group, so there are a number of epidemiological studies performed in Eastern Asia, such as Japan, and China, and South Korea, and Hong Kong. We have several data to demonstrate that not a few patients with PBC are present in East Asia now. Yeah.
And what do you think is responsible for the increased recognition? Is it because there previously used to be more of a focus on viral hepatitis?
Yeah. Well, it's kind of a difficult question to answer. And first we 3 years ago, in 2016, we performed a nationwide in Japan nationwide epidemiological studies for reducing the incidence of PBC, and we have performed the same study in 2004. And during that 12 years, the prevalence of PBC almost tripled in Japan. So to answer your question, the reason why the prevalence is increasing could be explained by several ways. The recognition of the PBC the disease may be increased during these 12 years among Japanese physicians. And so physicians started to measure anti-mitochondrial antibodies for patients with elevated cholestatic enzymes, and do liver biopsy and make a diagnosis of PBC. But besides, the second reason would be the real increase in the patient with PBC. And probably the second would be true, I believe, that because the other autoimmune diseases such as autoimmune hepatitis and primary sclerosing cholangitis or even ulcerative colitis, the prevalence is increasing in Japan as well. So recent trend indicate almost all prevalence of autoimmune diseases is increasing in Japan and probably in East Asia. Yeah.
And why do you think that is? I always worry that our Western diet is causing all sorts of problems. I don't know if it's having a similar impact on increase in autoimmunity.
Well, as you know, the development of PBC is caused by the combination of genetic factors and environmental triggers. Of course, genetic factors will never be changed during these only 20 or 30 years. So environmental triggers would be responsible for this increase. And as you said, the diet is changing greatly. And also now we have living in a very clean, maybe too clean hygiene circumstances. And of course, there might be several, the pollutions or antibiotics or drugs and foods. So the combination of these factors may be contributing to the increasing.
Mm-hmm. And do you think that PBC in the East is the same as PBC in the West? Is there any data to suggest that the disease may behave differently in this patient
Well,
population?
according to the data we know, there is very few difference in epidemiology and clinical characteristics and outcomes in PBC between East and West. Yeah, and the treatment response will be the identical. Yeah.
Okay, great. Well, thank you so much for sharing your experience with me.
Yeah,
I really
my great
enjoyed
pleasure.
speaking with you.
Thank you very much.
Okay, thank you.
Thank you.